Hi, Jean-Enno. Great to have you here in the Bots and People podcast. Tell us a little bit about who you are and what you are doing.
Hi, I'm Enno Charton. So I'm the director for Bioethics and Digital Ethics at Merck Group. For those who do not know Merck Group is like a 350-year-old company based in Germany, headquartered in Darmstadt, mostly still family-owned. And we call ourselves a science technology company within the healthcare, so classical pharmaceutical business, life science, which is more like lab supply, biotech and innovative solutions, and electronics, which is semiconductors and liquid crystals. So like a rather broad, innovative company with a big digital business. And I've been part of the company for more than 10 years now. Actually, by training, I'm a biochemist and I did some cancer research. That was my PhD actually. And then you can already see how I maybe landed in this kind of company. Actually, I started out in something called medical communication, which was about sort of like how do we communicate our R&D efforts to the outside, but to the science audience, not to the general audience, but to the science audience. Mm-hmm. And through this work, actually, at some point, I started working for our chief medical officer within the company. So you can imagine that as the head doctor of the company. And one of the responsibilities also was taking care, beyond many other activities, of the topic called bioethics. Mm-hmm. Bioethics being sort of like the ethical behavior mostly in the medical field. Think about patient consent, that the patient agrees to a procedure. I mean, most of us know this as we undergo like a more serious procedure in the clinic, or the doctor, they will ask our agreement, they will inform us, and this we call this informed consent. And you can imagine that within the pharmaceutical company, sometimes you encounter these questions: how do we do this in the right way? Do we have all the data ready to go to clinical study in human subjects? How is this happening? How do we do this in innovative ways? Or if we have like completely new therapies, how do we approach this? Sometimes these ethical questions came up, and this is something that actually my manager was looking after. Part of my task working with him as chief of staff was also taking care of this kind of, let's say, organizing. Not content-wise, but organizing this kind of group. And this was very interesting, actually very appealing to me. And then when after 3 years of working for him or working in this role, actually it was decided that this topic has become so important and needs higher visibility that it cannot just be the side job of somebody, but needs like its own lead. I agreed to be nominated as the new chair for, let's say, then bioethics. This was 2018. We actually ventured into more digital solutions. You can imagine the first big pushes on AI, the EU AI principles, the first ones being formulated 2018. But then also sort of like certain business models came along, and I will talk about them later on. And that's when we decided, okay, it's not going to be only about bioethics, but actually the big topic of future is digital ethics. And this is actually the focus of my work in the last few years.
Mm-hmm. So you were basically the founder of this department within Merck, of the ethics department.
The first bioethics work was created, let's say 15 years ago by other individuals, but sort of like I was the one that sort of then built this up as its own department, and I hired specialists in my team that take care only of that, and it's no longer just a side job with somebody.
Yeah. And then you said in a side sentence, and that sounded appealing to me to be in that role. What exactly fascinated you? What made it so appealing?
What this work entails, or what actually the past was mostly, it was managing the Merck Bioethics Advisory Panel, which we now call the Merck Ethics Advisory Panel. But actually, this was a group of bioethicists that came together from time to time and supported the company. So you have to think these are leading worldwide academics, and they advise the company on certain topics. And for me, it was fascinating to discuss with these individuals. And so this is something that, I got so much insight in ways that I've never have thought possible. I'm not an ethicist, and you will always be like a small layperson next to these really like global leaders in their fields. But nonetheless, this I found very exciting, that I can interact and get perspectives from very different places, and something that often we do not factor in our work, but that may often seen something as ivory tower people that come to us and to give us their opinion. But the interesting thing is discussing with them and finding, let's say, pragmatic approaches to do the right thing within the company, and even thinking ahead. If you come with certain standards, you can make yourself a very sort of like recognized business or responsible business in that field.
Yeah, it's interesting because it's healing diseases in the end, pharmaceutical companies. So that's something really good for the world, right?
If you talk to scientists that usually work in the pharmaceutical industry, most of them is saying, I went into science or went into cancer research or whatever because I want to improve lives. I mean, I realized that I'm not a good researcher. That's why I quit research. That's something I'm doing something different now. But obviously, this is something that aims us. And I mean, obviously, you can discuss sort of like pricing and IP models, but the overall idea is obviously to improve lives. And sort of like, how can we improve lives in a responsible way? And this is something that also guides us now in the digital age. It's like, how can we improve lives? And this may not be like just medically, but also beyond that. Obviously, there's many other applications for digital in our company. But how can we do this in a responsible way? How can we do innovations, and especially breakthrough innovations where regulations are not known yet? How do you evaluate something, or how do you handle something in the right way when there's not regulation, there are no ideas or rules yet? So, because if you're a company and you invent the breakthrough innovation, and we have some of these, there's no law, you can just use it however you want, more or less. But if you do that, then this might damage the trust in the long run. And you think about, okay, the long-term thinking of a business. And that's what I ties back also to what I mentioned before, is that we're a family-owned company. And this is for 350 years, or 55 years now. And we don't just think in the next 5 years or next 2 years or next quarter, but also what happens in the next 30 years. The next family generation also quasi wants something. And that's sort of like, it's also something that enables my work. And when I talk about my work, some people are astonished of what's happening and what has been happened in digital ethics, especially in the company. And I would say, don't feel too bad if like your organization is not at the same level, because several factors really play key roles here. And that one of the culture, and the other one is especially the family ownership. So it's not easy copyable to others, but it's just as how this all came together.
How can I imagine the work of your team? I will be a bit provocative now. You're sitting around a fire and philosophizing about what is right or wrong, and then you write a letter to the C-level, or what is the day-to-day work looking like?
I wish I would like to have like a nicer office with a chimney, but yeah. So what does my work look like? I lead a small team of experts that have like double degrees in ethics and science, for example, or also just project managers supporting us. And so what we are, and sort of like how you can see ourselves, is that we are sort of like an in-house consultancy for ethics questions. And I think in-house consultancy, most people will know. These are people that come in for certain projects, help you with certain things, and then move on, and they give you advice. They don't take decisions for you, but they give you advice and reorganize your department this way. This would be a good strategy. And this is something that we offer for the entire company for bioethics and digital ethics. So people come to us and they ask us questions of like, I have this project, how do you do this? I want to sort of like, we are losing a lot of AI in HR now. How can we do this in a responsible way? We have some example projects, but we really want to do this like set a process up in a responsible way, because obviously in HR, AI is especially sensitive. Like, what do you have to set up? Can you help us with a process? Can you help us identifying ethical risks? And then this is sort of like where my team sits together, sort of we do different things. Like obviously some projects we evaluate, some, let's say, easier things we can just sort of like solve ourselves. And then we sit together with the teams and discuss the solutions, or what they sort of like, what recommended actions are, or what's there in the literature. The more complex questions actually we bring forward to our digital ethics advisory panel. You heard me talk before about the bioethics advisory panel. Actually, when we started going into digital ethics, we did a copycat of this in the digital world. Sort of like we identified like leading experts in the digital ethics field, the AI ethics, data, privacy, and anything you can imagine in that area, got together. And for example, what we do a lot is consult with these panels on a regular manner. This is a lot of, let's say, preparing these kind of panel meetings really for a good discussion. I mean, this is not, you can say, okay, there's a question they will discuss, but already you really need to prepare it well and have the right pre-reads in place, so that these high-level experts that we invite from the external world can discuss in a meaningful way, give us really tangible recommendations, practical, pragmatic, and then sort of like, once we have these recommendations, work with the teams and how can we implement them. It's up to them to implement, but often, obviously, they're looking at us as, okay, how can we implement this? What's the good way? And so a lot of our work is managing these kind of panel work. For example, the digital ethics panel meets 4 times a year, and you can think that the preparation is like 1 month of a meeting. I mean, not purely, but it starts a month before, and then you can see, okay, how much time this takes up of my everyday. And then beyond that, a lot of the work that I do is, especially I do, is what I'm also doing here, creating awareness on the topic. And this is not just externally, because, well, why do we do this? not because we're purely a good company, but I already told you we do this because we want to stay in business a long time, and we see this as a, let's say, responsible way of doing business. And we see that in the long run, digital business models will not be successful if there's no trust, especially in areas of digital health. And so I do this externally, but also a lot internally. So people have to know that we exist. There's no mandatory process to come to us with a certain project, but the way is more that people know that we exist, and then they come to us, and sort of like when they have like a gut feeling, oh, there might be something that's not working too well. We train people in identifying challenges, for example, and then they come to me.
Do you rather pull the brake, or rather do you need to accelerate people to start going more into digital topics? Are they more concerned and you can calm them down a little bit, or do you need to say, hey guys, this is not ethically correct?
The break thing is an interesting thing because our chief digital officer, or chief data and AI officer, actually, Wally Mehana, he comes from the automotive sector originally. And he always says, when it comes to ethics, why does a car have brakes?
To drive faster, right?
Exactly. So you can drive fast. And that you have the ethics in place, so you can drive fast. If you need to brakes, you can hit them. And that's a very nice analogy. So why do you have this? I mean, it's not per se meant to slow down anything, but it's sort of like, okay, but you have certain things in place to check and to be safe. And this is sort of like the organization overall, it's two-sided. So obviously you have a very big data and digital organization, and it's really going into it's very highly digitalized organization. But beyond that, we also have, obviously, there's sometimes a little bit of mistrust in solutions that are developed also internally. Think about what I just said, all the AI solutions in HR. Obviously, we have a very strong workers' council, or workers in general, that would be like, okay, what's happening here? We need some kind of trust. And for these ones, I think it's very important that they know that whatever we do is in place, and so that there are guardrails, and there would be somebody that said, okay, this would be not the right way to do certain things. And on the other way, it's sometimes I have to slow down people a little bit, but it's not per se that I say, okay, you cannot do this project. All the time that I've been doing this, there's never had like a project where I had to say, no, you cannot do this at all. This is like no-go. Often people imagine, you develop a project, then you go to the ethics group, the ethics group like say, no, sorry, this is not happening, and then everything goes to the paper bin. And this is sort of like a little bit also the bad perception people have of ethics groups. But what we more do is that people usually come to us early on, or I recommend to them to come us to early on and say, okay, we want to do this, and then we come, okay, yeah, you can do this, but a little bit, this would be like the frame where you can do this and take attention to this and this and this and this, so you do this in a responsible way. And later they come, let's say the more difficult it might be to adapt certain things, but it's not a way of stopping people. This is also not my intention. It's more enabling responsible innovation.
Yep. And do you think your internal consultancy service, I would call it, is underused or overused?
That's a good question. You never know what's not brought to you. I mean, my team is busy, let's say that. So that's not. But then, I mean, we're a small team and catering to 64,000 employees. So it's a good question. There are some areas where sometimes okay, you could maybe profit from a little bit more of advice. They definitely do not come up to us too often. There might be departments that say that are more willing to come to us. Let's say, for example, HR. I mean, HR people are more trained to think a little bit more about the human in the company, or would this create mistrust, or would this sort of like solution be difficult for some people? So they were one of our first clients because they just thought about it. The longer our success story goes, the more people from all over the company approach us.
Okay. Then let's go into some examples, and I want to go in 100% from now. What is the most interesting ethical question you came across in the digital space?
That's the most interesting. It's difficult to differentiate, but something that always comes again and again is obviously, how do we educate people in the way that they can give their full and fully understand consent to sort of like that their data is being used. I know that's a little bit boring for some people, but if you look at the details, it becomes really tricky, because obviously individual as if like a doctor comes to me and said, here, this is your data, you're undergoing some cancer treatment, and we would like to ask you to use your data for research, and this it can be used for, and this it cannot be used for, and these are the risks, and these are the challenges that come with it, but this is all the opportunities that come out of using your data. I might be understanding that, but 99% of the population will not. And how can you do this kind of education in a way that people understand what might happen with the data, and you don't just, let's say, screw them over and say, you're doing the right thing, and then they just sign the paper. But no, they should willingly accept or willingly agree or refuse that this should not be happening with the data. And how do you do this kind of education with people? This is the basic of all these kind of things. And this goes to any solution, whether it's like data business or it's certainly AI applications that shall be used. This is always the topic we come back. How do people give consent, or how do we enable them to give the right consent? And there's no solution yet to that question.
I find it super interesting, especially because I'm pretty pragmatic with giving consent. So when I want to use a service and then I need to give consent to use the service, I give usually consent. So I'm not a person who reads the very small texts that are shown there. But I also sometimes think, and I'm interested in your opinion, when, let's say, I would give consent at a doctor even about my health data being used for pharma companies, I would be not so concerned about. I would just think, okay, then you get my health data, but in the end, what you want to do with it, that harms me.
Yes, that's let's say a very rare opinion, especially in this country. There's a high willingness, for example, of people donating data for medical research. But as soon as if it's private sector have interest in this data, the numbers drop drastically. Yeah? So it would be like more than at least half the population is very fine with it to give data for medical research. But as soon as it sort of like goes into the private sector, then this drops down to 30% maybe. There is a certain mistrust. There also was misbehavior of the industry in the past. We see the challenges, okay, because obviously you need certain infrastructure and certain things and certain applications that's only happening in the private sector. I mean, think about drug development, let's say public institutions, they do the basic research, but they do not do the clinical research. We can make use of the data in a certain way. I mean, one big thing and one example like giving is a virtual control arm to a clinical trial. Think about how clinical trials are run. I mean, this is not something that's a little bit of future music, but this is something that we hope that will happen someday. Clinical trials are made in a way that you always have the current best treatment for a disease and the new treatment you want to develop, and you have to compare them. And this is how you get sort of like the whole thing in the end approved by the authorities, and you can market it. Your medication has to be better than what's out there. Otherwise, you do not get approval by the authorities. Which means, okay, you have to set patients on the actual treatment that's right there right now, the normal treatment, and then at the same time you have, let's say, 50 people, and then you said also 50 people on the new treatment. But in the reality it's not 50, but it's 500. And so if you have like 500 people on the standard treatment again and 500 people on the innovative treatment, it makes it very expensive. Think about that cancer trials cost 200-300 million euros. And at the same time, there might already be signals that the innovative treatment is much, much better, but still you have to run this comparison. And you would give these patients a suboptimal treatment, although you already can, from early phase 1-2 trials, you can see that there might be probably very strong reaction. Why would you give them an inferior product only to do a study? Can we just take already existing data, or let's say partially of this control group? Can we, or the famous placebo group, people will know that. Can we just take existing data, very standardized, that we did in the last, let's say, 5-10 years, and use this as comparator arm, for example. And this would be something where we can really nicely use existing patient data and then compare it with the innovative treatment, and then nobody would have to be in that control group at that point anymore. I mean, that's not there yet. I mean, this is not something, but this is something where I see this would be extremely valuable because it would accelerate clinical trials. It would lower the costs, so also the cost of your medication, so also later on the cost of the medication per se in the market, and then also at the same time take this ethical problem of the placebo group away. I mean, and it's a long story, but that's something where I try to convince people. So think about why private sector institutions might use your data.
It's super interesting. This is a hard ethical problem or complex one because you also need to finalize the research to then make sure for future patients to have the right medication.
And the idea with this data donation is always that usually if people do this, and for example, they go to a cancer center and they get treatment, and what they do when they donate the data, it's never for their treatment, because usually they will not profit from it when they donate their data, but it's always the aspiration or the idea, okay, if I donate my data, this is for, let's say, the future patients, maybe in 10 years, because that's going to help them. And that's also something that's critical in the education of patients. You will probably not profit from donating your data in this, at least in this therapy. Maybe if you survive this cancer and you have the same one again in 15 years, maybe yes.
And is there ethical questions where a lot of people are concerned with or thinking about, but you think it's actually super easy and straightforward?
Let's say there are questions that come up again and again. I think they're always in a little different nuance, but let's say they're not as critical. I mean, think of data usage. I mean, many things in data usage and data privacy are regulated, and these are standard things. And this is not something per se where we think about, okay, this is something where we need to tackle this in an ethical manner. And this is often people, like especially in ethics, they misunderstand me as data privacy, but data privacy is something different. It's like a legal department. So we obviously within compliance, we have a big data privacy team, and that's something completely different. That's something that we regularly encounter.
Okay. And let's also go a little bit into this AI ethics field. You talked now quite some bit around data. Is it the same? So is all AI ethics issue, AI ethics topic also somehow a data issue?
Well, we came up, and I'm going to do an extra loop here. I mean, when we set this up in the company, I mean, I mentioned we've created this digital ethics advisory panel, which is sort of like a little bit of really of the guiding group, but also what we put in place is the code of digital ethics, which lies out our basic principles and rules. And people can go to our company website and have a look at it. There's like all the details on that, but there's also actually scientific publications on that. You can also find them on our website, just to see it. So this is really rooted in science. And the idea here was that actually, under the bioethics that we had worked in, we do have sort of like we do not have, and that's the key thing, we do not have a clear, let's say, ethical principles when it comes to data and AI yet, or data and algorithms. And we need something to orient ourselves on. And bioethicists, they would always go and say, we have these established principles over the last 50 years, and we refer to them, and then this is how it guides us. And we realized, no, we need to put together first a set of principles that we can measure ourselves against and say, okay, if we uphold these principles, then we are quite sure that we are behaving ethical. And this is something we have been doing in the company. I mean, so this is something that we actually implemented in the company, this code of digital ethics. And you already hear, so this is like a data and AI perspective at once, because you can never think about AI without thinking about the data. Obviously, the AI model always needs to be trained. And even if you use an AI model, there's always a data inflow, data outflow. How is this data being used? Where does this come from? I mean, for example, using data from a source that you do not know would always be unethical. I mean, you cannot just say, I found this nice pot of data on my somewhere on one of my drives. Oh, this looks interesting. I want to use it. Obviously, this would always be something that's not ethical. You always need to be able to trace the data, for example. And there's you can have a look at our website. For those that are interested, there's really like a detail of these principles, and our employees are trained on this, or let's say all digital employees are trained on this. And it's not per se important that they understand each principles, because this code is very complex. It's 20 principles, but it's so complex because we use it actually to build analytical tools in the company that help us identify ethical challenges. For example, we have like what's called the Merck Digital Ethics Check in some areas, and they're all a little bit different depending on the area, but with a few easy questions, project managers can see whether their data or AI project has ethical challenges. And if there's it's a risk, and if there's a risk, we give them tips how to handle them, but they can also come to us and deal with them. And this is due to a way that I need to be able to scale my work in a certain way. This is obviously not meant the perfect solution, but this gives a little bit of a triggering or preparing people, sensitizing people for ethical challenges, and at the same time giving them, let's say, an easy check solution.
What are examples of those easy questions?
One of those very easy ones is, how's your model being trained, or what's the tool being for? Is it making decisions about humans, for example? Then obviously this becomes a much higher sensitivity than if it's this, or how is the model trained? Is this like like self-trained model, self-learning model? What kind of model is it? So then, and this is then sort of like the way. Then what we have now, I think, is like 10 questions or so, and then you get like a risk score out in the end.
And can you remember any sort of specific project that needed to change course or needed to readjust the setup when they started working with your team?
We sometimes had projects where it was a little bit about, okay, maybe here's a little bit of a line that you should not cross, or this is sort of like, I think about this in a way, but we never had to change projects in a fundamental way yet. I mean, because usually people that do these projects, they obviously have in mind the long-term success of things. And then they come to me because they already have certain worries. It's never like a fundamental change that has to happen. It's usually more nudging them in the right direction. Often they come very early nowadays. That's sort of like when they come with ideas, and we can easily say, okay, in this frame, this is possible, but for example, these options you cannot do.
And were there in the work, especially in the AI or digital field, points where you changed your perspective or where you personally changed your opinion about something because you dived deeper into it?
You mean like a certain application
or certain belief about, for example, I think we should give the AI as much data as possible. Or it's just a random example, or we should never put personal data in our training model, something like this. And then you think, oh, was one person of my team or of the project team that convinced me to think differently.
Maybe, but I wouldn't not have yet an example. But for me, it's more like a bit by bit continuous evolution, let's say. I'm not especially trained in data digital, so that's obviously, I'm not a data scientist or anything like that. So some of the details may always elope me, and of some problem statements I never had thought before. So obviously, when the whole ChatGPT came around some time ago, this is something where I was, okay, should we be using this? Is this something where we are a little bit skeptic or should be careful? And then actually our chief data and AI officer, who was rather visionary, he said, okay, no, I want people to be curious and stay curious in digital solutions. We make this available, to everybody. So we encourage them to use it. And at that point, it was the openly available version. They said, okay, you can use it, but please know that don't enter like sensitive internal data and all these kind of things, like here's do and don't do. And I thought this is actually a smart idea that we actually encourage people using these tools and do not say first, well, we have to check everything in detail first before we start using it, but say, okay, it's like using Google. Huh? It's like, okay, you go to the ChatGPT website and just enter your question, use it for your work. Be careful on the data that you enter. We actually came up with clear do and don't rules of what should happen, what you do, and that you don't enter this kind of data and you don't do this. And then, but at the same time saying, okay, use this. And then half a year later, like most companies nowadays, we had our own internal GPT where we could at least enter internal data. Obviously, secret data or very confidential data and personal data is still out of the question. But for example, this is something I think where he did some convincing, saying, no, it's good to make it available to people earlier. So because it's now in the media, everybody's going to be curious, and encourage them now to use it. And we got very positive feedback on that. And this actually, many companies forbade the use of the GPT technologies for a long time, external ones, even if you do not enter internal data, just because they were so afraid of data offload. But then you see sort of like the productivity level that, or the improvement that it brings, for example, for somebody like me, it's so high that I cannot imagine sort of like not using it.
I need to think about the metaphor of your CIO, right? Say with the brakes in the car.
Chief Digital and AI Officer. He actually was the CIO, so there's something different. We have somebody that takes care of D, but he's doing it for data digital or data and AI.
Yeah, because then not allowing people to use it is like putting a wall in front of the car. That's the heartbreak. And also I like how you did it, that you decided to, hey, we have let's say a sports car, a car that should be very fast, but then you have also pretty powerful brakes built in with the setup of your team.
And also something that people think sort of like that we usually come to a team, we give advice once and then it's gone, and sort of like this is actually something, especially longer and bigger projects, people come again and again because obviously the scope of project changes, and obviously it's a feedback loop actually that's more or less running. So they come with the first questions and then feedback, and then they get feedback or advice from the experts. But also these experts, they are like global leaders, like these experts. One of them, for example, is John Lamka. John Lamka, you have to imagine he's right now leading the Mayo clinic platform in the US, one of the biggest and most innovative clinics. But what was his role? He was the CIO of Harvard for 20 years. He was on Joe Biden's team, the advisor for health policy and all these kind of things. So it's like really outstanding individuals. And these would not be with us if they would just give advice and then not ever hear anything back. But they want to know what happened with the advice. Do you take this serious? Is there like, and so we can see there's like a continuous feedback loop that the team then that got the advice and has been working with us, they report back, okay, to the panel, okay, this is sort of like the solutions that we have developed, or this is how we try to address your advice. And yeah, here this worked, and here we have a few challenges. And then sort of like they give advice again, or they're like, okay, yeah, this is cool. How you implement this is great to see how you like were able to address this advice. And this is why these people stay with us over years, because we've seen this in other big tech areas where ethics panels were created, but dissolved pretty quickly, in one example even after 3 days, because they realized they have no impact. So this would be sort of like, I would call it ethics washing. And our experts are still there because they know that they're taken seriously.
Let's look a little bit also into the future. Are you actually looking a lot into the future when it comes to AI? And do you prepare ethical boundaries when you hear, for example, Sam Altman talking about AGI now and saying, hey, we're going to achieve that this year? Or do you say, let it come and then we think about the ethics for Merck?
This goes both for the bioethical as well as data and AI ethics field. Obviously, we think a little bit ahead and we see, okay, what's coming? What might be coming? We're always giving the literature of things of that may be coming and how do we deal with them. Think in the bioethics sphere of organoids, mini organs built out of cells that help sort of like us using less and less animals for drug development research. And here things are progressing very rapidly and we have to be ready. So how can we use them? Think about embryo-like models where people might think you're trying to build an embryo, but it's just a few bunch of cells we put together. And these kind of, and how we do this, sort of like we knew this technology were coming. And once it became like actually a business for us, or our business went into it, we were like, okay, look, we have certain ideas ready already. How can we deal with it? How do we do this in the right way? And the same goes for data and AI. Obviously, when the first GPT models came around, obviously it was very quick sort of like looking into, okay, how can this be used in a responsible way? What kind of things have to be ready for that? So this is part of it. But usually our business teams there on the front of innovation, they will come to us early on with whatever is on the horizon.
In your view on bias, because what we do is offering training for enterprise, and we have one of these examples where you prompt show a boss in a large enterprise and then it shows a white male in the mid of the 40s or something. And I imagine for diseases and for decision making on what kind of things you're going to develop in the future, how do you look from an ethical perspective on bias in AI?
It's a critical thing. Looking at this, especially think about if we want to use AI to support us in, let's say, drug development or clinical trials. Obviously here, bias is something that's extremely challenging, also because historical data is always biased, especially in the US, who is part of the clinical studies. These are white people, Caucasian, usually rather well off because their insurance covers sort of like these kind of trials. Or they make it into these kind of trials. Okay, and so obviously then if we then train models with the clinical data, obviously the decisions they would make would always be sort of like based on probably white males. We all know that medicine, how it is nowadays, it's tailored for men and not for women. Like all the things, the most studies are done on men, and for women, we have no idea also how certain medications work. And this is something that we really have to pay close attention to if we train models. How can we take this bias out? And it's not an easy thing to take the bias out that's there, the historic bias. Because also, for example, go to a different field, go to HR and think about, okay, how can we, when we have an AI that helps us now sort of like identify the best talents in the company for leadership roles. And we train it with the historic data of the company. And obviously, with that, it would usually recommend male leaders. Just because they have been most careers were like men. And how do we edit out this bias in the right way? And that's not an easy task because obviously you may put a false bias on it. And this is something obviously that's with us and lots of other users with AI, this is going to stay a very alert topic. And also, obviously something that the EU AI Act is also looking strongly into.
So important to have it on the radar. And also, you said in the beginning that you train the organization or you raise awareness for the topic, especially. How is that working within Merck? You have a small e-learning, or is there events you facilitate?
It's end. So obviously we work on that thing. So I mean, you can do anything that's sort of like in the classical corporate literature. So obviously we have like trainings, and this is like basic and advanced training in digital ethics, which some of them went to all employees, other went to all, just like only to more digitally, let's say, more data and AI jobs. And then what we do quite some events within the company. I speak in a lot of leadership forums, sort of like putting this down, or like data scientist teams invite me to talk about the topic. And then obviously the whole thing then goes into our intranet. Obviously there's a lot of news on our intranet, and this is something that we use, and we have a lot of information available there. Then we do the classical newsletter communication, which also happens. Quite some things I do on LinkedIn, targeted especially for internals. And this is also something, I mean, or actually internal people are, I mean, internal, say, flow of information is happening within LinkedIn. I mean, not internal information, but sort of like people become aware of that. What I do is like, cool, this is another company, I'm going to follow him. And then, yes, so this is, and then what we also have, especially digital, we have like the very strong data and AI community. And sort of like the leader of this community, our head of data culture, she is really also a big fan of the work that we do, and we are a key part of being that of that community. So people that are in this community, they will have heard about us. And these are going to be the people that drive the relevant projects. But because think about, especially about AI, how many people do we have in the company that might really be able to develop, or let's see, at least integrate AI solutions in the company? You know? Obviously, there's always going to be like the rogue one that just buys one with his credit card and uses it on the side, yes. The others, sort of like the 500 to 1,000 people, I mean, these we have covered because they will be part of these kind of forums.
Okay, and the fundamental training on ethics, which is probably including be aware of bias and think of the data. Is this mandatory for everyone, or you still offer it to the organization?
No, so actually, the basic training is mandatory. I mean, it's mandatory to everybody with the computer. And so obviously you have to think about a company. Actually, I wanted to make it mandatory for everybody, but then somebody pointed out, wait, we have like 15,000 production workers.
Yeah.
That don't have a computer. If you give it to them, then actually they have to take time off their shifts and go to the central computer and do the trainings because they have to do the trainings they are assigned to. This obviously for them it's not, but for those who like are desk workers like we are, it's mandatory.
The time flew by already really fast. I have two more questions. The first one is, did I forget to ask a good question to you?
What I usually ask is, what you're doing is just ethics washing? Isn't this just like nice for show, and then you do something else in the back?
Is it?
This is where I say, yeah, well, no, it's not. And this is the obviously I would say this, but I would also not be in this position in the company. If this is a certain integrity, I would not be doing it just for show. Huh? Yeah. And I mean, I can see like all the ways we have developed trying to put this, like several of the things that we do in digital ethics, we have actually published as papers. You can find this. Huh? So it's like putting us out in the scientific community, open to criticism or ideas for improvement. Then you can see this is peer-reviewed outcome. Huh? So they can see, okay, we take this seriously. There's something serious behind. We have these individuals, as I mentioned, like these outstanding individuals that advise us in the digital ethics advisory panel that would not be with us anymore if they would see that this is just for show. And all these kind of things show that there's actually more to this than just nice to say, but no, we actually make this serious. And for me, for example, was one of the biggest achievements that the last year I was part of the Capital Markets Day. Capital Markets Day is actually when the investors come and ask the company questions. Huh? Like for a day, investors come and they ask. And speaking time is very limited at these kind of things, and very few people only are allowed to present. Huh? And I was very proud that I was asked actually 5 minutes. It's not a long, but actually this actually has something of relevance to the investors. Huh? And so this is something where you see, okay, your work has an impact because this actually, if this is important to investors, this has an importance in how the company can finance itself. Maybe even cheaper because we get better investor offerings or whatever. Just sort of like we're doing business in a responsible way. And they trust us that we will not harm ourselves by using AI.
Okay, that was the content of this 5 minutes, basically.
Yeah, exactly. Okay. And sort of like what kind of tools we have put together.
One last question then. What is a link or a resource or a really cool thing I can look at? But just one thing to dive a bit deeper into digital ethics would you recommend?
That's a good one. I always say, check our website. Yeah, you get a bit of a good idea. And I mean it because we have tried to really come up with ideas. Okay, how can we explain what we are doing? What's the core of digital ethics? How is this working? And there's also, I'm not going to advertise it, but actually there's from big consultancies, there's good like 1 or 2 pages on sort of like what's the impact of digital ethics and why you do it. And it's something I like to give to managers. because there's a nice McKinsey report, and if you give a McKinsey report to a board member, then they're usually willing to listen to it, and it shows very nicely sort of like how critical trust in digital solutions is and how companies that put emphasis on this actually grow faster.
Yeah.
And that's usually a nice, convincing body.
Yeah. Also high chance that they worked there before.
Yeah, also that.
Okay. Joe, I know it was an absolute pleasure to me, and I myself learned a lot. I found the conversation super, super interesting. And thank you a lot for giving us these insights. I think it's very valuable.
Thank you for having me. And to all people, out there, feel free to reach out to me on LinkedIn and ask me questions if you're curious about the work that we do.
Thank you.